So what we're doing here is we're doing an elongation stretch. We're kind of putting some pressure on the top of the pelvis and sliding up to the bottom of the ribs. The idea being that we're once again taking more pressure and more strain off of those lumbar erector muscles, plus like a little bit of a nice sweep across like the superior glute. How do you feel with that pressure? Is that feeling good, Mackenzie?
Yes.
Good, good. And then I'm going to switch sides so we could do the same thing on the other side. I might slightly be blocking the view for everybody watching here, but hopefully you can still kind of see a little bit of just this elongation and this long strike pattern that's getting created right here through the lower lumbar muscles there. And it's nice usually to work up into your thoracic spine too, right? Because I'm sure everything's starting to kind of get bricked up in there too, right?
Yep, definitely like compact for sure.
Right. Now, one of the things you were telling me, correct, is that you feel like you're starting to get maybe a little bit more shortness of breath because you just don't feel like there's that same lung expansion that you could get before, correct?
Yes, for sure.
Yeah. And so that's kind of one of the indications to actually keep adjusting in the thoracic spine is if we make sure, hey, we might only be talking like millimeters of movement, enhanced space, but it doesn't take a lot of space change to make a difference for what your baselines of symptoms feel. So if we're, helping to take some of those restrictions and fixations out of the ribs and get like a little bit more expansion at the thoracic spine, um, heck, even if it helps you just 25%, that's 25% more words you can get before having to go, right? All right. How about a little